Yes, for making sure that you're still on the right path. Okay, so it's going now. Okay, good. I can see that it's going. All right, so maybe if we can start with you just introducing yourself for people who are not familiar with who you are, you could just give us a bit of an idea about who you are.
Okay. So thanks again for having me, Shauna. Say hi to everyone. I hope everyone is keeping safe. As Shauna said, I'm Andre Morgan. I'm a graduate of the University of West Indies in Jamaica, and I'm currently finishing my residency here in Washington, D.C. at Howard University Hospital, where I have the privilege of serving also as one of the chief residents there. So as it pertains to the USMLE route and as well as doing USCEs, whether observership, externship, and so forth, I've done it all, I've been through it all. What I've not experienced before is anything like this in my lifetime, which we're all going through. I'm sure it's pretty novel to everyone.
Right.
Mhm.
Okay. So just as background in terms of for those of us who aren't there, what are things like now just where you're working in your hospital setting? Are things any different or is it pretty much the same?
Yes, it's actually pretty different. I think the DC experience is probably very different from what's happening perhaps in like New York or in Washington
Mm-hmm.
State itself. We don't have, especially like at my hospital so far, we don't have a lot of cases. But for the most part, things are pretty quiet, a little bit.
Mm-hmm.
Sometimes it feels a little bit chaotic, a lot of uncertainty here. It
Mm-hmm.
feels a little bit surreal to be out and the malls are scant and you're not seeing a lot of people roaming the streets and so forth. A lot of people taking a lot of precautions and so forth here. And in terms of in the hospital setting, it's pretty much like that too. Um, a lot of uncertainties in terms of what's going to happen. And I think a lot of staff, hospital workers and so forth, we're also concerned because
Mm-hmm.
we're largely frontline also. People do have families and so forth that they're concerned about too. And this seems to be affecting everyone, rich,
Mm-hmm.
poor, famous or not, everybody
Right.
being affected. So I think from that stance, it's also a little worrisome.
Okay. For people who are currently in residency, will it in any way sort of interrupt what's going on with their training or it's business as usual and you guys are going to finish on time?
Definitely, and I think that will this may be the talk for the entire evening. It's just a lot of uncertainty, like we're just not sure. So as it is
Mm-hmm.
now, it's definitely affecting residency. ACGME that governs our residency has put out statements on their website uh, in a way to quench a lot of anxiety and so forth that persons will have about. The impact it will have on training. And for example, will this mean that I may need to stay an extra month or 2 months because I couldn't do that particular rotation or I didn't finish this number of procedures and so forth. And I think so far the Graduate Medical Education Committee has been rather supportive in saying that as it is now, we don't know a lot in terms of what's happening, but a lot of things won't be held against us.
Mm-hmm. Okay. All right. Sorry about that.
Yeah.
Okay. Hello. Yeah, so
Yeah.
you can share your video now, I think. Sorry about that.
Uh,
So you're saying that now and those things will not be held against you.
right. As it is now, we're trying for those things not to be held against us. I'm trying to. Okay. It says. I think it says the host has stopped the video. Okay, that's fine.
Okay.
That's fine.
All
Yeah.
right.
So the consensus generally is, especially for people in their final year of their programs, whether residency or fellowship, the
Mm-hmm.
consensus largely now is things won't be held against. We understand we're in a pandemic, we're in a very trying time as it is now, and a
Mm-hmm.
lot of programs throughout the country they've had to restructure what they're doing.
Mm-hmm.
I saw one program saying, for example, we have to pull our residents from or and our fellows from areas or specialties that are not so heavy to places like the ICU or so forth, just to help with the burden in terms of the number of cases and so which are coming in. So as it is now, a lot of uncertainty, but I think the committees are offering their support and saying, well, for the most part, we won't hold anything against you.
Okay, so it seems like nobody can plan. So I'm wondering even about how do we start talking about how different IMGs can plan. But let's say, for instance, you were planning to place your application in September 2020, we're in
Mm-hmm.
2020, hoping to match in 2021. And for you, you know, US clinical experience was going to be integral because of various things. So maybe we can start by just talking, if you could share with us a little bit, what is US clinical experience? Then we'll go on and have some other conversations so people can start to plan differently.
Right, sure. So US clinical experience, for the most part, refers to hands-on experience that physicians or medical students will get in the US health system.
Mm-hmm.
And usually when we say USCEs for short, we're referring to externships, which are more like hands-on experience that people will have. And sometimes it will include electives if you did them as a student in medical school. If you did outside of medical school, we tend to call it externship. Other things sometimes that people put in the basket would include observerships, even though that's not hands-on. So depending on
Mm-hmm.
who you're speaking to, they may not consider that US clinical experience, but observerships and sometimes and research experience.
Okay.
So that would largely be it. And it's becoming an integral part of the application process as it is now, where people different bodies want to know that persons in the US have seen your work, and can more or less vouch for you, whether through a letter of recommendation or otherwise.
Mm-hmm.
And I get it. It's really crucial now, especially for people going into 2020 March, and not to be all doomsday today, but it is really and truly a lot of uncertainty. A lot of programs have pulled, and the general consensus is, if you're even within the US, if you have an elective outside of your program in another state or in another hospital or so forth, as it is now, there's a standstill. No program is taking in any persons, even from in the US, into their program right now for an elective, and nobody's allowing their residents to also leave. So I think that also trickles over definitely on an IMG trying to come up with, whether or not you had something in April or May or in June, as it is now, at least for those 3 months coming over to do those. Generally, I think as it is now, it's definitely a no-no.
Okay, so in terms of just staying focused on solutions, right? For somebody who US clinical experience might have meant a lot to the strength of their application, and if you want, you can talk about what that kind of applicant would look like, who would have that profile where clinical experience would be very helpful, and it's something that they can't get. What would you advise them to do instead? Like, do you have 3 tips? Do you have a top 5? Like,
Right.
what would you say to them in terms of moving forward?
So that's a very good question. Typically, US clinical experience stands to be an advantage, I think, to anybody, right?
Mm-hmm.
But generally to the applicant that has scores which are not competitive, or to the applicant that's been out of medical school for probably more than 5 years, or if you have red flag things on your CV, whether it's a prior failure or your transcript in med school, or there's something red flag about you, then US clinical experience is of even more importance to you. As it is now, in terms of tips going forward, I was thinking about, okay, what do you tell someone now who had a lot banking on this? And as it is now for the US clinical experience, not much you can do right now, right? And we can just hope that we get through this. And just some generic things which may even say then that I think my video started to share now.
Yay.
Okay.
Right.
Right. But some general tips as it is now, and it sounds pretty cliched and so, but I have to stress that is one is actually staying healthy. All right. And it sounds like we're like, oh, okay, but really and truly, anybody in this now, we are frontline persons. You may be in a situation or in a country where resources are limited and so forth. It's not regular day anymore. You really have to make sure that you take all precautions in terms of protecting yourself as you go through, because one of the worst thing you would want is to go through this and then this runs over. Standards lower a little bit this year because they understand that the world went through hell, and then you are sick and you're unable to do your exams, or you're unable to go through the whole application process. So it sounds simple, but one of your goals is now is to actually try and be as healthy as possible, following all the CDC guidelines and so forth, hand washing, protecting yourself from patients who are suspicious. So that's one of it. And then I think just being up to date with what's going on in terms of what the different bodies are saying. Things, ECFMG is largely what would govern what IMGs are doing. And I think probably just tuning in, subscribing, to whatever medium, making sure that you are up to date with what ECFMG is saying, and complying with that. So I think those two, and I mean, during this period, a lot is happening. If some persons may still be probably finishing exams, or if you just have step 1 and step 2, and you probably weren't planning to do step 3 because you're planning just to do your USCEs, then this may be a good time while we're in quarantine and social distancing and all of this is going on to really buckle down really on your exams and try to maximize your score, right? Maximize the score of whatever you're going to do, or if you didn't plan to do the next phase of your exam, probably do them now.
Mm-hmm. Okay. Mm-hmm. All right. Do you really believe that programs are going to be somewhat more lenient, knowing that people weren't able to get clinical experience? Because then anybody could say, you know, I had it on the books, I really wanted to, but then I wasn't able to, or...
Right. I think it's a hard call, and I think it will definitely go down to the committee that accepts people coming in. But we did go through, or we are going through a pretty rough time, and I think this has affected everybody. So as it is now, when they're looking at candidates and so forth, I'm expecting that this will affect people, right? I think this will definitely affect the US grads, the US students who are going to do, or to do exams, who are trying to get exams done in time to come in the program next year, right? So so when they're looking at that, I really think people may consider, say, well, you know, possibly we could, we understand their situation, or if you present yourself in such a way, then they could. I'm being optimistic that they really could.
All right, so we're looking at basically you just remaining healthy, keeping on top of the information in terms of when programs are taking people, when you can test, and using any of your time in quarantine just to buckle down on your studying. Okay.
And I think one final thing would be, and would be a good thought is, while even though I say, you know, ensure that you're healthy, one of the thing too is, as we think about, because your goal is how can I improve my CV, right? One of the thing now is, if you have a COVID-19 body,
like a task force,
or like a task force, perfect, that's actually word, like a task force at your hospital, I would encourage you to become a part of that, right? If there are voluntary things which are going on in the community as it pertains to that, I would encourage you to be a part of that, while of course maintaining your safety, because things like that will look good, right? You're going above and beyond during this time of need for other people, and putting yourself forward. You're not necessarily trying to, of course, do that just to say, but I think it's an innate nature that comes with us as physicians. I think you could leverage that also, right? As a way to say, well, this is what I did during this time. And it would be a good point of discussion, even in your interviews and so as you move forward.
Okay. And so for people who are truly borderline, I know that this will end up being a very personal decision for individuals, but for people who are definitely like, you know, I had a step 1 failure, or I had a step 2 failure, and they were definitely trying to get in that, and this is mainly for the FMGs, they're trying to get in that step 3, trying to make people see how they work, and they can't. Do they push back applying for a year, or do they just shoot their shot, knowing that it's their decision in the end? So this is just a general thought and not specific advice to anyone. But if they're really going to need people to see them and to know them in order to have a chance, does it make sense to just go for the match anyway? Or is it a situation where you get all your ducks in a row, but you wait to place that application until you can get your clinical experience?
Actually, I would say, as you said, we're not necessarily giving advice, and everybody's situation is important. And that's why, like a coach or so, it's important for you to sit down and work out with you for your own unique situation. But generally, my stance would be definitely go for it, right? And I say that because it only takes one application with one interview for you to match, and you never know, you may just click with the person. Probably there's someone from your country or so. So you never know. So I definitely say still go for it. As you go through the process, for example, so if you're doing a one-on-one coach with me, or for example, and we're talking, I may say, well, okay, if your scores aren't that great, and if we're really banking on US clinical experience, then what I may say is, well, don't give it your all this year in terms of number of programs you apply to. We may say, well, okay, let's curtail your application to the programs that I think you're more likely to get into, right? I may say that depending on, of course, the application, the person's application. But I wouldn't say definitely to withdraw from match and wait a year, because I think every year you wait, it gets harder. And a lot of persons may not match in their first year, even when they're good applicants. So I think going through and getting the experience of being in a program, talking with people, understanding the interview process, even if you don't match that year, I think that's like tremendous experience that you can take forward into your second year of trying.
Okay. Thank you. So keep moving forward, don't sit still. All right. And so for the last batch of individuals, for those people who have matched and they're looking to start, are there any talks about, at least at your institution, without giving away anything, are there any thoughts about whether that start will be delayed or that they can look forward to business as usual?
Well, so I can't, of course, I'm not, as it is on this, I'm not affiliated with my institution right now, talking now.
Right.
And I have not really heard in terms of what different institutions are going to do now. I think as it is now, a lot of persons are hyper focused on just making it through this month, because now a lot of hospitals, and so we are seeing the surge in COVID-19, right?
Mm-hmm.
But I myself have been thinking about it, given my role like as a chief resident and so forth, and getting that new batch in. And this has really far-reaching impact, because as it is now, I think a lot of persons know the embassies are closed.
Right.
Right? And this is a time when a lot of programs start the entire application process, which is rather tedious. For those who don't know, well, you will soon find out. Because the year I matched, 1 week after I matched, the paperwork started to come. Every week it was just a ton of paperwork that just kept coming until it was time to come here. So everything kind of had a time stamp. And a lot of things may go to the state level, and then things may go to the hospital level and so forth. And as it is now, a lot of those organizations are closed or they're focused on something else. So my concern is, I'm thinking, okay, particular for IMGs, because we're the ones who go through a lot more paperwork, people may not be able to start on time. And I think that's definitely something that institutions are now considering, to say, well, what are we gonna do? I don't know. From my institutions, I don't know. I think we're just going with it a minute at a time, a day at a time, and then see. But I think that would be one of the fear. The good thing though is the match is binding.
Right.
So if matched already, then you've matched, right? It's just a matter of hospitals and different institutions figuring out how to get you there. And probably you may end up starting a month late, 2 months late. You may start on time, who knows? But whatever it is, I think they'll find some way of working it out. And even in the future, because you starting residency late may definitely affect if you want to do fellowship 3 years from now, because you must finish 3 years of your program. For example, if you're doing internal medicine, I think they will also, the different bodies will also consider that as we move forward. But right now, I think as it is, it's a little bit early to really say what we're going to do.
Okay, thanks. And then my final question, I'm just going to jump back to the USCE actually. So for some individuals, I know that this is their target period, but just based on what I've seen over the years, sometimes people will go in July, they'll go even in August, maybe even in September. If it happens to be that somebody can squeeze something in at the last minute, right? Like an IMG who's watching this, things clear up, they can knock one out in August and another one out in September. Is that something that you would recommend?
Definitely take it, because as you go through, you apply for a USCE. One thing we spoke about in one of the conference we had was you strategically placing your USCE, right? And different people place it at different points in time. One of the advantage that you have is if you're doing your US clinical experience in August or in September or in October, then one of the things is you're actually there at that institution where they get to see you and they get to see what you can do and hear what you can do. And if they were not going to send you an interview, for example, if you were out of the state, but the fact that you're there and they're seeing what you're able to, then that's one possibility. They may send you, they may invite you, seeing that you're already there and they've seen you based on that. As well as people may be able to vouch for you if you rotated in July or August. They may be able to vouch for you later on, even though you're not there, to say, hey, I worked with this guy or this girl and they were pretty good. Consider sending them an interview. So definitely, I think it would be worthwhile. If you do it later, you may not be able to get a letter of recommendation to put on your file to aid your application. But I think definitely if you can get a squeeze into an institution later on down, then definitely go for it.
Okay. All right. And I think that goes back to the point you made earlier about just staying abreast of the news.
Right.
So that if a program, some of them have just been like, no, we're not doing anything at all for the rest of the year. But right. But for those who still might do something, it still might be a useful avenue for you.
Mm-hmm. Yeah.
Okay. All right. Well, thank you so much for joining us, Dr. Morgan, Andre, everybody tuned in, or if you're watching this on the replay, be sure to share it with your friends. I actually thank you a lot for coming on, because I know that so much is onshore at this point. So just being willing to have the conversation, although it's not like you can tell people do one, do two, you know, in terms of when it pertains specifically to their clinical experience.
And Shana, I think another question you had asked me, and I think someone had asked me too, I just shared, was about like doing exams now. And
yes.
And I did say one of the things following up, as I said, with the website, right? So for example, on the Prometric website, ECFMG and so forth, the testing centers are closed now, right? So definitely it's a time to maximize your studying. If you had exams planned, now it's been pushed back. And I think they're also not charging persons to change the period that you can do your exams and so forth. So I just want to point that out to say, well, just definitely maximize it. And I think the idea is they won't hold it against you. And I think later on, they may try to expedite scores later on. So use the time wisely.
Okay. All right. Well, thank you so much. And I hope that that was helpful to people. As somebody, I'm one of those persons who I'm always planning everything out. So I just know it probably is so disheartening, you know, to a lot of people to, you know, you had those plans but, you know, you have to move forward despite it. So,
yeah, it definitely threw off a lot of persons. I'm sure, especially as you said, persons who like to plan. But I do think there is some sunshine somewhere at the end of it. And it's just being optimistic and getting ready to ride the wave and go for the opportunity as soon as it comes out.
Yeah, and to go ahead and apply, like you said, because all it takes is one.
Definitely.
All right, well, thank you so much for your time. And if anyone has any questions, you can feel free to drop them in the comments under this live. And I'm sure that Andre will answer them when he gets an opportunity.
Okay. All right.
Thank you.
Thanks again. Bye.
Bye.